everyone. I'm so delighted to welcome you all to our new episode of Taco Talks today. Today, I feel extremely honored and privileged for the guests who I have with me. Our first guest, Dr. J.P. Jaiswal, a cardiologist from one of the most renowned hospitals in town. He's as full of life as he's full of wisdom. He's fun, energetic, and believes a healthy heart needs as much joy as much medicine. Our second guest, Dr. Pooja Jaiswal, a radiologist by profession, a spiritual soul by spirit, an all-time mother, and I have to tell you that with her ever youthful skin, she proves that age is just a number. So let's find out if she's a sannyasi or a sassy doll. Hello doctor, how are you today?
Hi.
You're fine, thank you.
Thank you, Arushi.
You know, honestly, I'm shivering from within, but thank you for being here. I feel that I'm honored and my family must be really proud to see us here today.
Oh, thank you.
So,
Thank you,
it
Arushi.
means a lot to me. Thank you.
so much.
But firstly, what I want to know is, how do you do it all? You know, with Dr. Saab, as we fondly like to call him, and you do insist that I call you Pooja, but I don't know, let's see. So I want to know that I see that you guys have a great balance of life. You are into a serious profession, but also when I meet you at parties and social commitments, how do you do it? I would really want to know on that insight.
I think, Arushi, I'm following this life is a celebration. So we are celebrating every moment, from work to, raising my children, to even just, doing my gardening, to meditation and being sassy, as you said.
Always.
Yeah.
What about you, doctor? What do you think it is?
Actually, if you see life in toto, this is a mixture of happiness and sorrows. Being as a cardiac doctor, heart doctor, I've seen a lot of death every day, and at the same time, I used to party a lot also. We have to balance the life. You should always, once I'm off the hospital, I don't, recall all the patients and thinking about always being obsessed with the patients.
I think it's really beautiful to learn that from you, because I see most of us, our families these days, office or work always comes home. Being doctors, being married together, do you think it's challenging sometimes? Or you think life becomes easier? That, both of you are doctors and two doctors at home, being husband and wife, or it gets more challenging? What is it?
I think I can understand what he's going through, when he's coming tired from work, or he has a lot of serious patients. I don't have that kind of work since I'm into diagnostics. So my work is more like an office work. I have to make the report. I'm not dealing with the patients directly. He's dealing with the life and death directly.
Yes.
But still, at the same time, I can understand. So I think it's more kind of a balance. It's better because we both are in same profession.
Yes.
So I think it's better. I can understand and correlate, and at the same time, he also can understand what
Yes.
I'm going through. And sometimes we take help of each other.
Wow.
Yes.
So it's a
Sometimes
It's
I
a
make
blessing.
free diagnosis for him. I'm not paid for that.
I think, the best part is that most of the doctors couples, I will advise them that once you are out of the hospital, back home, don't talk about the hospital.
Okay.
Don't
Okay.
talk about the patients, because if there is always your life also, it's not only patient's life. Most of my colleagues, they used to say that, well, how come you go and mingle with everybody?
Yes.
Because you try to understand the other thing also, like hotelier business or travel agent or pilot or whatever. I don't want to be very frank, I don't want to party with a doctor, because most of them only talk about the patients and number and the diseases.
So I think our privilege, I would personally talk, my privilege comes from there, that I get a chance to, hold my glass and do cheers with doctor sometimes at parties, and it's a great feeling, doctor, honestly. Whenever I've met you, I have felt so comfortable in just being myself and at least trying to hold a conversation with you too. So we love you. I'm sure you feel that.
So we are learning, so much from you people also, what's
Really?
happening, what's new.
Really.
Of course, we have doctor friends, but at the end of the day, you want to, talk about other things as
Yes,
well.
yes.
So I think it's a very perfect balance
Wow.
we are having you in our life, people like you in our life.
I see that Dr. Pooja has beads around her.
Yes.
Do you want to elaborate a little?
I am Osho sannyasi,
Okay.
and I have recently taken sannyas. So Osho, I'm sure you must have heard about
Yes,
Osho.
yes, definitely.
So Osho's theory is life is a celebration.
Wow.
So he just says my sannyas is you don't have to leave anything. You don't have to go to Himalayas.
Okay.
You can be there. You can be in your most glamorous outfit, and the only thing you have to do is meditate and get connected with your inner self. And I think the most wonderful thing I have ever done in my life is to take the initiation from Swamiji.
Wow.
Yeah.
You mentioned, doctor, that it keeps you grounded, being spiritual and following a practice. I would like to know from both of you that living such a successful and a really, admired life. People really admire, adore the both of you, and you're really successful. How do you balance your ego, for the lack of better words? Because it just comes sometimes when you're successful, when you're admired. How do you keep yourself grounded?
Arushi, that's the whole journey, We are learning, and I'm on this path. And the
Yes.
most important thing, if you can remove your ego, you can, you can conquer lot of
Okay.
things. So that's the main thing.
What about you, doctor? You don't follow the path. How do you still so grounded?
I am like from very childhood only. I am telling you, so as long as I'm in a white coat, I'm a doctor, and outside the hospital, I'm not a doctor. So I don't consider myself. I'm a general public. You can talk to me anything. You can only in the hospital premises only. I'm a doctor. So the success, I've never seen myself like I am a very successful doctor, or never thought in my dream also. I think that I'm like saying whatever ordinary doctors are there. So they same journey. So even in a corridor also, if somebody is saying that I'm having this pain, I will not ask them that go bring
Form
the
bhar ke aao
ticket.
pehle. Yeah.
You go and bring the ticket and you
Yes.
take the appointment and all this. I don't believe in this thing, in these things. And for last 20 years, 25 years, 24 years, I'm practicing, and I've seen that is giving me much more satisfaction. And later on, after that also, I'm getting a lot of appreciation, a lot of Dil Ka Doctor types,
Yes.
Munna Bhai MBBS
Yes.
type. I mean, that is the thing, that thing should be in each and every
I
doctor.
was just thinking of that.
Yeah,
that Dr. Saab has actually proved कि अगर कोई bench पे मर रहा हो तो उसको form भरना जरूरी नहीं
No,
है.
no,
नहीं है.
I don't. I go myself and bring them there. Ticket and goli maro. I mean, that is not the thing.
I think what I understand from both of you is that our core essence is being human, isn't it? It's being human, it's being real, being ourselves, and life will be beautiful. And we will be beautiful, we will be shining, isn't it? Is that a little secret?
We already are little.
Exactly. So, is that a secret of being so youthful forever?
Yeah, it's an open
Yeah.
secret. Arushi, it's an open one.
Little technical aspect we'll get into. A few questions just. I see that, doctor, the AI, robotics is taking over. Do we think that sometime in future, later in life, that these robotics are going to take over us? Or do you believe that the human touch, the human compassion will always be necessary for a patient, and not just a robotic treatment?
Let me tell you, Arushi, that in my clinic, whenever I see any of the patient, I used to touch the patient. Number one is that. Touching the patient is very, very important. Maybe in coming days, in due course of time, the robots and the AI will be taking over most of our work. But at the same time, the psychological feeling of the patient will not be there if somebody is not touching the patients. Yeah, that is there. So
I mean, it's just a machine.
it is
It's
a
irreplaceable.
It's irreplaceable.
Yeah. Technology can make, like in my field,
Yeah.
AI can make diagnosis,
Right.
but they cannot counsel the patient.
Right,
You
right.
understand? You need a person, to make them understand that, you'll be fine, you'll be okay.
Absolutely.
Yeah, so it's irreplaceable.
And that comfort, I think, is so
Yeah.
important.
yeah,
very
that is
important.
very important.
Another thing that I have, doctor, is, I don't know what's it, but last 6-8 months, 1 year, this age bracket of between 35 and 40 has been very, very vulnerable. The sudden cardiac arrests, sudden strokes. I mean, it's a wave that's going on. I really want to be enlightened on it, doctor,
Let me highlight some of the points why we are having a premature heart attack. I mean, you must have heard about this. Somebody is doing gymming, the lifestyle is okay, the diet is okay, everything is okay. In spite of that also, they are dying in early age. There are 3 things which I really wanted to highlight. One is a physical exercise, diet. Diet means that you have to have a healthy diet, DAS diet, that is nuts, peanuts, fruits, vegetables and all. Second thing is that your physical activities, that is at least for 30 to 45 minutes, you should brisk walking, even a brisk walking 5 days a week, 30 to 45 minutes is more than enough.
Okay.
And third thing is that your sleep. Because you are always, whenever you go to sleep, you are with the mobile, you don't know the time, you're doing something. So at least 7 to 8 hours sleep is must. So 3 things we have to highlight. And apart from all these things, yes, of course, there are 5 things which is very important. If you are hypertension, you have to keep your blood pressure in a normal level. If you are diabetic, your diabetes should be controlled, your sugar level should be controlled. If you are smoking, please don't smoke. If you are having a lot of stress, then try to release the stress in the means of whatever you want. I mean, by physical exercise, by dancing, by jumping, or make the heart being active. And alcohol, I will be saying whoever has not started alcohol, you should not. But moderation drinking is okay. 1 or 2 glass of red wine, that is a good to increase the HDL cholesterol, which is a
The
good
good
cholesterol.
If someone is in such a situation, someone has had a stroke or is feeling uneasy, what is that one simple homely thing as a first aid that a family should do? That, if someone's feeling that, okay, I'm feeling uneasy or I'm not feeling okay, what is that one thing the family can do? Is there a medicine they should instantly give? Or is it CPR?
I know, stroke means that you wanted to ask me that if somebody is having a chest pain. Chest pain.
They feel that, it's a stroke.
if somebody is having a chest pain, and then chest pain has that 3 quality of chest pain, because sometimes it's very, very difficult to distinguish between chest pain and abdominal pain, gastric pain. So most of the time, whomsoever I've seen, whomsoever dies broad dead, broad dead is that you are holding yourself. No, it's a gastric.
Absolutely.
Because heart lies just above the abdomen, so that people can't distinguish between the abdominal pain or gastric pain or the heart pain. So there's a typical characteristic of abdominal pain. Remember this, that if the abdominal pain is there, the gastric pain is there, it is continuous, the fluctuation will not be there. Even if you are walking, climbing stairs, running or sitting, you will have that constant pain. But if you are having heart pain, then it aggravates on walking, aggravation of walking, and the pain duration is also very. Somebody is having a flinks of seconds of pain in the heart, that is not a cardiac pain. So a cardiac pain is a 3 characteristic. One is a retroexternal chest pain, heart pain. lasting for more than 25 to 30 minutes.
Okay.
And it should aggravate on walking or climbing or strenuous exercise.
Doing anything, activities.
Yeah, and it is relieved on rest.
Oh.
So relieving factor, aggravation factor, and the duration factor.
Duration.
So if three things, and apart from the perspiration, the typical chest pain, left side, it doesn't mean that only left-sided pain is a heart pain. Some of the heart attack patients used to come with the back pain, the pain at the chin,
Oh, really?
pain at the back. So that is also heart pain. So it's a typical nature of pain is also there. So remember, you should always keep aspirin. Aspirin is a poor man's streptokinase, means that thinner poor man's streptokinase.
Yes.
Give aspirin,
As soon as
70,
you
feel that 75 or 150 milligram. If it is abdominal pain now also, because of gastritis, nobody is going to die. I mean,
I know.
So
If you
at
just
least,
give an aspirin.
Yeah,
Okay.
give an aspirin, go to the doctor, get a ECG done. That is there.
After our really insightful conversation, here we are to our second segment, the rapid fire segment. Hope you all are excited. And you too.
Yes.
So, Dr. Pooja,
Yes.
the first thing you do when you wake up,
I express my gratitude.
Botox, green smoothies, or just good genes? Spill the secret.
I think good genes and daily greens.
Oh.
And no Botox.
Your kids call you cool mom or a strict mom?
I think I'm both. I'm cool enough to make them laugh.
Wow.
And I think strict enough to make them listen.
Oh, nice. The nation wants to know your secret of looking so youthful.
I think my super active meditation
Okay.
and very healthy lifestyle
Okay.
and my skincare.
What ages you faster, stress or sugar?
Oh, stress is the culprit,
Oh,
darling.
really?
Yes. Stress is the one, main designer for the wrinkles. Sugar just dims the light a bit.
Ah, nice. We're getting some good insights there. Describe your closet in 3 words.
I think my closet has more drama than Netflix.
Oh, wow. One life lesson your kids have unknowingly taught you.
I think while I was raising them, I've understood I'm raising my own fan club.
Oh, nice. One thing you wished women stopped apologizing for.
I think confidence, your style, and your soul, it's totally unapologetic.
Unapologetic.
Yes.
Lastly, what does living life fully means to you?
So I'm celebrating every moment and I'm savoring the happy moments,
Yes.
learning and growing through the lessons.
Lessons.
And I believe in, magic of miracle.
Wow.
So yeah, that's my life.
How beautiful.
Yes.
You were fab. You were really fab. Dr. Saab, you have a tough competition.
No,
Yes. Okay.
I prefer to lose.
I'm sure. Secret to a happy married life. Yeah. If you could prescribe one non-medical thing for a healthy heart, what would it be?
The movement, whatever you love, either dancing or exercising or doing all the physical activities. So that is a free of cost.
Do heartbreaks really affect the heart, or it's just a Bollywood thing?
No, it's not a Bollywood thing. No, it's a very good question you have asked me, because there is a broken heart syndrome.
Yes,
So
yes.
broken heart syndrome or a stress-induced cardiomyopathy. In the broken heart syndrome, it's a very good question. It's a medical question only. There are a lot of release of stress hormone. So that is what is called catecholamines
Okay.
and adrenaline.
Adrenaline.
So adrenaline surge is there, and that causes the endothelial dysfunction and causes the dilatation of the heart and become, so there are.
Do you want to tell the boys of the world, Dr. Saab, to stop breaking girls' heart?
Yeah, true.
एक बार थोड़ा सा डांट के.
Actually, I'm not in that age also. So yes, I mean.
किसी का दिल मत तोड़ो.
He has broken many hearts already.
Oh.
No, so this is a very, very, very controversial question. So I think yes, I mean you should not break the heart
का
of
दिल नहीं
anyone.
तोड़ना।
किसी का दिल नहीं तोड़ना चाहिए.
जितनी हो सके जोड़ो.
Yeah.
What do you do to keep your own heart happy and stress-free?
I think by doing whatever I like, I go to party, I go to do the walking, simple walking for 30 to 45 minutes. That is more than enough.
Success in career or peace of mind? What comes first?
Peace of mind is much more important than that.
Healing the body or healing the mind? What matters more?
I think if your mind is healed, your body will follow.
If you had to prescribe one alcoholic drink for the heart, what would it be?
I think red wine.
Red wine.
Yeah.
One underrated key to a healthy heart?
Lack of exercise and all those things. Yeah.
Physical routine
Yeah, diet and exercise
and sleep.
sleep. 3 things.
To you, lastly, what does living life fully mean to you?
I think life is a parallel. It's not a sequence. Life is a parallel means that the happiness and sorrows goes like the same line. Once you start thinking that it's a sequential life. After 10 I will be doing this. After this I'm going to get married. After that I'm going to earn the money. And then you get depressed and you will be having all this. So life is a parallel thing.
Everything will come together.
Parallel. And once you realize that life is a parallel, you're not going to get depressed.
Wow. Lovely, tough competition I see here. But thank you. It was a great rapid fire. Yeah. Here we are to our third segment, which is the game segment and my most favorite. Our game today is a 5-second rule game. I'm going to ask you questions one-on-one, easy questions, and you have to answer to them quickly without giving it too many thoughts. Ready? Okay. So, Dr. Pooja. 3 things your husband does that makes you happy.
When he selects clothes for me, when we go shopping together, and when he doesn't force me to eat.
Wow. 3 nicknames you lovingly call your wife.
Sometime bunny, sometime baby, sometime poo or something like that.
Oh, he has many. 3 places you'd like to go on a date with Dr. Saab.
I would like to go Rome again and again,
Wow.
Greece, and most definitely Bangkok all the time.
Really?
Yeah, beaches.
Beaches. 3 things you secretly like about Dr. Pooja.
I really admire her for her routine, her timing, her gymming,
Yes.
and her spiritual journey.
Wow. Wow. He has many. 3 funny things you argue about with Dr. Saab.
Who looks better?
Of course.
Who's-
You.
Who's people's favorite?
Oh.
Of course you. Yeah.
And who's kids' favorite?
Oh.
Of course me.
Wow, that's sweet. Dr. Saab, 3 cocktails you like. Since we know you are a party fanatic, so 3 cocktails you like.
Number one is sex on the beach. Second thing is Long Island. Third is a Bloody Mary.
That was fast. 3 things you hear in a hospital.
The only thing I hear in the hospital, you don't look like a doctor. आप भी doctor हैं?
Dr. Saab, 3 body parts that start with the letter L.
Body part L is lungs,
Yes.
leg,
Yes.
and what I don't know.
I have one in my mind.
That was a trick question. That was a trick question. 3 things that doctors do on their day off.
Watches all the Netflix drama.
Yes.
He has to call friends home if we are home.
Yes.
And then take a nap.
Take a nap. 3 medicines people often misuse.
Number one is pantoprazole, all gastric medicine.
The Pantop D.
Pantop D.
Okay.
One is a paracetamol, the painkiller.
Okay.
Painkiller, all these NSAIDs, non-steroidal anti-inflammatory, brufen, paracetamol, Dolo and whatever. And third thing is that laxative purgative. Laxative purgative means that if you are constipated, you used to take all this isabgol, sometimes some juice, sometimes some medicine, herbal medicine. And also 3 things are mostly misused.
One extra question for you, Dr. Saab.
Yes.
What races your heartbeat faster? The stethoscope in yours or 10 messages from Dr. Pooja?
I think 10 is
10 messages, right? It's a universal problem.
Yeah,
You
yeah.
could be a cardiologist, but
Yeah.
your wife can make your heart race.
I am his cardiologist.
Oh yes,
Yeah.
you were his cardiologist. How
Yes.
lovely.
Yeah, thank you very
That
much.
was lovely. Clap, clap. Thank you,
end
Arushi. Thank you.
To end this, our game round on a sweet note, I know that you have a little bit of Shaira in you, don't you? I've heard that here and there.
A little.
So would you like to do a little Sher o Shairi for us?
शेर व शायरी. Okay, so I would like to say one शेर जो मुझे किसी ने कहा था.
Okay.
ठीक है. किसने कहा था नहीं पता है.
अच्छा.
So मैं सुना देती हूँ आपको. खलबली है आसमां में, खलबली है आसमां में, सब यही पूछा किए. खलबली है आसमां में, सब यही पूछा किए. कौन फिरता है ज़मीं पे चांद सा चेहरा लिए.
Wow, 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 wow. Somebody very rightly said that to you, right? You have a reply to that, Dr. Saab?
No.
Lovely to see you too.
Thank you very much,
And
Arushi.
this was a lovely round, so I think clap for all of us.
Thank you very much, Arushi,
Thank you,
for
yes.
inviting
Great
us.
time.
Yes,
And
yes.
we had a really great time.
Thank you
Thank
so
you very
much.
much.
Thank you so
Thank
much.
you
It
very
really means a lot.
Yeah.
Hope you had fun.
Thank you.
Thank
Yes,
you
we have.
so
Thank
much. Thank you.
Namaste.